hypertension? Well, May is Hypertension Awareness Month, and it's important to know the signs and what to look out for. So joining us today is Dr. Jodie Donovan with internal medicine at St. Luke's. Dr. Donovan, thanks for being here today.
Thank you for having me.
Okay, so first of all, just what is hypertension, and like what are some of the symptoms people would need to know about?
So hypertension is high blood pressure, and it's technically diagnosed when blood pressure is over 130/80. The hard part about hypertension is that many patients won't even have symptoms. But when patients do have symptoms, they can look for things like severe headache, severe anxiety, pulsing in their head or their neck, even a nosebleed.
So it's kind of like that feeling of you literally feel anxious, like
Correct.
and with breathing and everything. So why is it important, though, to keep an eye out on your blood pressure?
Well, what we're trying to prevent are any side effects of hypertension over time. So really the concerns would be like a heart attack, a stroke, chronic kidney disease, or even dementia over time.
What's the best way to keep track of these things, of your blood pressure? What do you recommend for your patients?
Well, for healthy patients, you should be seeing your PCP at least once a year, and it's recommended that you have your blood pressure checked annually.
And then if you have any kind of symptoms or signs of it, is it a good idea to maybe have a cuff at home where you can keep track of it? Does that happen too?
That does happen too, of course. Sometimes you can use the blood pressure cuffs that are found in pharmacies that can use as a surrogate, but ultimately it's important for you to check your blood pressure at home if you do have high blood pressure and need to keep tabs on it at home.
Now, obviously, there's medication that can help people control their hypertension, but what other ways can patients be proactive about, really keeping it down?
So lifestyle modifications is a big one. It is the key to keep blood pressure down. So I'm talking about things like diet, focusing on fruits, veggies, that low saturated fat diet. Also increasing activity at least 30 minutes a day, most of the days a week, reducing salt, and also moderating alcohol intake.
Okay, and so how can people learn more about this topic?
One of the places you can go is online to the cdc.gov, and also the American Heart Association has some great topics and tips on this topic.
Is there anything else that you'd like people to know as far as, maybe keeping an eye on each other and your family or your friends?
Yes, I think the thing is to know that high blood pressure is easily treatable, and so if you notice a family member mention, gosh, I have a new headache, I'm feeling more anxious, maybe one of the first things to do is encourage them to talk to their primary care provider.
Okay, Dr. Donovan, thank you so much. Great information on, Hypertension Awareness Month as well, so I appreciate you coming in.
Thank you for inviting me.
Absolutely, and we'll be right back with more of the News at 4.